What should you do if already vaccinated and exposed to COVID-19? According to the U.S. Centers for Disease Control Prevention, CDC, the vaccinated people against COVID-19 but are exposed to someone who has tested positive for the disease need to consider these three things. Vaccinated people do not necessarily need to isolate if they are exposed to someone with COVID-19. Vaccinated people have a low risk of transmitting the novel coronavirus to unvaccinated people. However, they should be cautious around unvaccinated people and those with compromised immune system. Vaccinated people should do COVID-19 test if they begin to have symptoms of that disease. The vaccinated people also should still monitor themselves for symptoms of COVID-19 for 14 days following any exposure. The CDC confirms that an exception is given if the person has symptoms of the disease. They should isolate themselves and not interact from other people as long as they have symptoms until at least 10 days have passed since their last positive COVID-19 test. Lastly, they should get tested for the novel coronavirus. It means that regardless of vaccination status, anyone with COVID-19 symptoms should receive a viral test immediately. In conclusion, knowing the COVID-19 status is important regardless the vaccination status. The typical symptoms of COVID-19 include fever, cough, breathing difficulties, loss of sense of taste or smell, congestion and fatigue. Some symptoms of COVID-19 may mimic those of the common cold, particularly among people who have a mild case of the disease. Furthermore, the federal government is considering whether to reimpose a mask mandate on vaccinated Americans to help contain the spread of the Delta variant of COVID-19. Because the latest mutation of COVID-19 is highly contagious and has led to a number of positive tests among vaccinated people and growing numbers of serious and sometimes fatal cases among unvaccinated people.